As a glaucoma specialist, I can tell you that I'm woefully inadequate in understanding how to manage patients with limited vision in terms of helping them maximize the remaining vision they have and adjust their lives in a way that it's safer for them at home and ambulating and getting around. So I think we probably way underutilize folks who are experts in helping kind of maximize the remaining vision of people that are kind of truly visually impaired. So our next speaker is Dr. Aaron Kenny, who's chief of the William Feinblum Vision Rehabilitation Center, associate professor at the Eye Institute of the Pennsylvania College of Optometry, Salus University, and we'll to be talking about daily tips for glaucoma and low vision. Dr. Kenny.
Hi, everyone. Thank you so much for allowing me to be here and to speak to you about something that I am very, very passionate about. So, like I said, I am a low vision doctor, so I work with individuals who have visual impairments. One thing I kind of want to just start off with saying is I see individuals across the entire age spectrum. So I see individuals from a couple months old till as old as you can be to come into the office. I see a wide variety of eye diseases, and a huge part of my patient population are individuals with glaucoma. So defining low vision, a lot of times people have this misconception of what low vision actually is. Some people have previously called it partial sight, subnormal vision. Those terms are actually a little archaic at this time. Some people, the National Eye Institute defines low vision as the best corrected visual acuity less than 20/40 in the better seeing eye. Scheinman, and Whitaker actually says that low vision is caused by an eye disease in which visual acuity is 20/70 or poorer and the better seeing eye and cannot be corrected or improved with regular glasses. However, what I truly believe low vision is, and what I think a lot of low vision practitioners believe, is that low vision is uncorrectable vision loss that interferes with daily activities. It is better defined in terms of function rather than numerical test results. So an individual who maybe has 20/20 vision, maybe they have relatively good visual fields, but they go into a restaurant and they have that dim illumination and they can't see the menu. In that situation, that patient is struggling from low vision. You should never be restricted from seeing a low vision professional because your visual acuity or your visual field does not qualify. That is not a real thing. Even a surgeon who has 20/20 acuity, perfect visual fields, if they didn't have the loupes or the telemicroscopes that were necessary for them to do their procedure, in that situation, that patient is low vision. So with that being said, I just really want everyone to be an advocate for themselves and to be understanding that if you are struggling with something in your environment, whether it's at home, in the community, navigating independently, this is something that you should be talking to your doctor about and seeing what options are available. But just to kind of give you a little bit of an idea why low vision evaluations are a little bit different, I'm saying absolutely continue to see your ophthalmologist, continue to see your optometrist, but the low vision evaluation definitely brings a different approach. Yes, we are going to check your visual acuity. Yes, we probably will ask you to bring your visual fields. But we do additional evaluations or additional exam techniques that can help us modify your day-to-day activities to make it a little bit easier and a little bit better for you. One thing I like to highlight is that when you come to see a low vision provider, it's a goal-oriented exam. So when you come to see me, I'm asking you, what are you unable to do and what would you like to do? And that your vision is preventing you from doing that. It might be something as simple as, I can't see my phone the way I used to, or I'm having a really hard time identifying faces if somebody says my name across the hallway, or I stopped traveling at night because I feel so uncomfortable. All of those things are different goals that we can provide or we can approach as low vision providers. So what we like to do is we like to assess the visual findings, We like to get an idea of what you're able to see. And from there, we provide device recommendations and additional referrals to other specialists. I kind of joke that low vision optometrists are like the gatekeepers to the rest of the rehabilitation world. There are a lot of things that I cannot do as a low vision optometrist, but I know a lot of people that can help you with your different goals and your different tasks. So just a couple things. I know that the topic was really daily tips, things that you could take home, clinical pearls that you can put in your pocket and walk out of here with. So I'm going to be highlighting the importance of good lighting, especially with our individuals with glaucoma. We're going to be talking about small print. So, I wish that, everything that we see out in the real world, out in the community, was at least 16-point font or larger, but that's just not the way the world is made. I'm also going to talk about mobility and driving. So this can be a sensitive topic, and I want to talk to you about information and how you can gather resources to help you feel more confident and independent in your travel. And then finally, glare and contrast. I did a talk yesterday, and I can't tell you how many people came up and talked to me after and said, man, you're one of the first people to actually bring up that glare component, how uncomfortable it can be when I walk into a grocery store. That fluorescent lighting is so uncomfortable. These are all different things that hopefully today I can give you and you can take home with you. All right, so the importance of good lighting. Contrast sensitivity is one of the first signs of visual impairment that's associated with glaucoma. So even in these very, very mild cases, you might be saying, hey, I'm noticing these changes in my vision, but when you record it on the chart, everything looks normal, everything looks stable, the visual field looks good. In this situation, it might be the contrast sensitivity, so the ability to differentiate between those lighter shades of color. So when I think of contrast, I think of it as those things that are not that bold, black and white. So if things aren't bold enough, if they're not black enough, if they're not dark enough, that usually is meaning that your contrast sensitivity may be affected. And what are some different ways we can help with that? So direct lighting can make more of a difference than magnification. A lot of my glaucoma patients, they don't need magnification. They need it to be bolder and they need it to be darker. So what we do is we often explore different types of lighting and illumination. But one clinical pearl I want all of you to take home, if you're having a hard time seeing something, I don't want you to go out and get a stronger wattage bulb. That's not the answer. What you should really be doing is you should be getting illumination that's closer to the reading material or closer to the task. So with that being said, there's this optics equation, not to get super nerdy on it, but the variable that makes a bigger difference in how much light is getting onto the material is not the stronger wattage that's in your ceiling, but the task light that has a gooseneck that can bring it closer to the reading material. An example of that would be that Cobra desk lamp. A lot of times people will ask, well, where can I get these lamps? Where can I get these different things? Honestly, Amazon, Bed Bath & Beyond, anything that has a gooseneck option that you can bring closer to the reading material is going to be beneficial for you. All right, let's talk about small print. So more than likely, you already all have a magnifier in your pocket without even knowing it. So I know a lot of, when I graduated in 2015, this was just starting to kind of become a big thing. But now in 2024, iPhones, Androids, they are low vision devices that you have in your pocket already. You can download apps, you can change accessibility settings, you can turn that phone into a very, very helpful tool. So one of the things you can do is you can actually go to your accessibility settings, and that can actually set up the different magnifiers on your phone. You can increase text size, and then you can also use your phone to see small printed material with the magnifier on your phone. Just the other day, I was seeing an individual, she had glaucoma. She said that she had her distance glasses, she had her reading glasses, but man, she was still really struggling with her medication. So in that scenario, I said, do you have your phone with you? And she said, well, yeah, but I'm not going to make a call. Like, why are you asking me to bring this out? And I demonstrated how she can utilize that phone in that scenario to be able to enlarge that print. Other apps, I'm not going to go into too much detail, but if you want to take a picture of it or if you want to write this down, Seeing AI is a really, really great app that everybody should have on their phones. So this is a free app, And what you can do is you can actually just hold that app once it's open over any printed material, and it will read it back to you. So in terms of my world, we call that optical character recognition, also known as text-to-speech. So once again, anybody, whether it's iPhone or Android just came out with it, Seeing AI is an amazing, amazing free app. You can do money currency with it, color identification, and it can do text-to-speech. Google Lookout is another example that does optical character recognition. Visor is something that we can utilize in terms of changing colors of printed material and magnification. And then Supervision Plus is another device or another app that we can put on our iPhone. So like I said, even if you want to explore this, these are really great apps that can be helpful in your day-to-day life. Mobility and driving. So there are options available if you feel uncomfortable navigating in your environment. Most patients feel very comfortable in their own home. We know where every table is, where every chair is. However, it's when we go out into the community that we start to struggle. So in that situation, if I'm talking to somebody who has glaucoma or a family member that is saying that, maybe their family member is having issues with navigation, I might be referring them to an orientation and mobility specialist. So this specialist will actually go out into the community with you. They'll help you feel confident navigating and traveling. Now, driving, I understand we are from all over, but just so you know, in Pennsylvania, you have to have 120 degrees of uninterrupted visual field in the state of Pennsylvania. If you do not have that, then you would not be legal to drive. Now, with that being said, as a low vision provider, I will never give you bad news without following up with other options or other available things. So in this situation, if driving is starting to become an issue, you need to be aware that there are other resources that are available that could work for you. And then finally, I did talk to some patients about this the other day. Glare control, especially while driving. Yellow can be beneficial, particularly in situations where contrast is affected. So if we feel that like curbs and stairs kind of look like slides, which is very common, often we will recommend yellow to make that pop a little bit more and make it a little bit easier. And then glare and contrast, just kind of piggybacking off of that. Dark mode on your phone can actually be very helpful with improving vision in terms of being able to see your phone. Sometimes that excess white background can cause a lot of glare issues, can make it very difficult. Bolding your text on your phone, that's an example of what we call relative size magnification. That's something that can be explored. All of these can be done in your accessibility settings on your phone. And then another thing that you could do when watching TV is actually turning the lights off while watching the TV. That can help with enhancing contrast. There are certain TVs out there, Samsung, it just came out with one, where they actually have a low vision mode. So what the low vision mode does is it does kind of a thickening or a bolding of the characters or whatever's on the TV screen to make it a little bit easier for that contrast reduction. So thank you so much for giving me the opportunity to talk to you about something I am so passionate about. We are actually merging with Drexel on Monday, so I probably should have updated my email, but that office number right there, if anybody would have any questions, you can always contact me. Thank you.
Yeah.
Thank you.
Okay.
Okay.